So I'm gonna talk about things that happen during pregnancy that maybe you haven't heard of yet, and this is not everything that happens. It's just some high points and some things that might be interesting. So one thing that happens when you're pregnant and when your partner's pregnant is you suddenly start having to think about, oh, there's certain stuff I can't eat, there's certain stuff I can't have. And when I went and Google image searched for this talk, this one was the most depressing thing I have ever seen. Like coming up with pictures of, you should not eat a pineapple when you're pregnant. You should not eat any kind of cheese when you're pregnant. So what I've got up here is the minimal list. The minimal list. And I also want to say that if you or someone that you know later in life is pregnant and has a miscarriage, it's usually not because of what they ate or that they slept in the wrong position. It's not that level of blaming or fault. A lot of people will feel that. Some people will just, well, I saw her eating a hot dog. So this is the minimal list. Drugs. Street drugs, no. Most over-the-counter drugs are actually okay. I'm not listing individual drugs here. Aspirin is not preferred. Ibuprofen is not preferred. Acetaminophen, which is Tylenol, is. And I found that acetaminophen did nothing for me. Like, you might as well not take it. But you're not supposed to take Advil. And different doctors will tell you different things, but you know, if you see someone taking cough syrup, don't shame them for that. Most drugs are okay. The detailed lists you'll get if you go into medicine. You should not drink alcohol in quantity. If you have a beer, your baby's going to be okay. This is very different in other countries than it is from the U.S. You should not be drinking alcohol in quantity. And in quantity is the important thing there. Truly high fevers in the mom are dangerous, especially at early ages of pregnancy. So in general, going to the doctor when you're starting to feel sick, taking acetaminophen if you're starting to get a fever, that can be helpful to avoid danger to the baby. Cytomegalovirus. There are some particular infectious diseases that are harmful to infants and not so much to the mom. This is one of them, cytomegalovirus. As far as how you avoid that, there are no special rules to avoid that, but it is one of concern. Listeria. Have you ever heard that you shouldn't eat lunch meat when you're pregnant? That's a new thing. We were talking about, Jennifer Mongold and I were talking about that and how, oh yeah, I eat a lot of lunch meat. Listeria is a disease that has to do with bacterial contamination of cold foods. It can be avoided if you just heat up the food. There's a trend now that, oh, pregnant women should not eat Subway or lunch meat. That's related to listeria. The risks of getting listeria from lunch meat are low, but there might have been, you know, five babies a year affected by that. So washing fruits and vegetables, you're more likely to get listeria from like bags of contaminated lettuce than you are from lunch meat, but that can be a danger. One that relates to you all, if you are on Accutane, or you will be on Accutane and you're female, if you're male, whatever. If you're male, it's really unfair. It's really unfair. Accutane in females, if you get pregnant while you're on it, that can cause serious birth defects. So I think if you take Accutane, which is an acne drug mainly, they make you take a pregnancy test before you take it, and you'll get a lot of warnings. Those are valid warnings. That is a birth defect causing drug that is particularly dangerous in pregnancy. But the big one is you should get prenatal care and you should be getting checkups. If you think about how many, not to hate on teen moms, but how many teens are out there that they get pregnant and they don't even tell anyone for 5 months. They're not getting prenatal care. Most of the time, that baby is going to be fine. Or if you think about nomads in the desert, getting prenatal care, most of the time those babies are going to be fine because the mom's body will give what the baby needs. If you're calcium deficient, your bones give calcium to the baby and your bones hollow out. Your muscles will deteriorate to feed the baby if you're protein deficient. So I think there's a little bit too much hysteria in the West about, oh, you're pregnant, you should be careful. You should be some careful. Next thing I'm going to talk about is morning sickness, and particularly hyperemesis gravidarum. I had never heard of this in popular culture until Princess Kate had it. I just love this meme. I thought that was funny. Hyperemesis gravidarum is not funny. What that means is super throw up while pregnant. Hyper too much. Gravidarum is pregnant. Emesis is throw up. Gravidarum. That is extreme, constant, debilitating nausea and vomiting during pregnancy. That is a problem mostly because of the effects on the mom, not the child. It doesn't hurt the child. In some cases, women that have this would have to go on disability for work. It's so bad. There are drugs that will help. Apparently, Princess Kate had it all 3 times. That's rough. So really, this meme is kind of mean because it would be hard to gain weight if you have that problem. And anytime that you have a question, you can ask me. I have not known anyone who had this. Okay. One of the things that happens during pregnancy that affects a lot of body systems and affects a lot of things in the mother is that your blood volume increases. Why does your blood volume need to increase when you're pregnant?
You can provide blood to the baby.
Provide blood to the baby, which is, it's going through the placenta and then going into the baby, so you need more volume of blood to do that. You also end up making extra volume as well, just in case. So this is probably the only graph I'm going to show in this class, but here's percent change from the start. So from non-pregnant level, red blood cells go up until delivery, and then they come back down. The plasma volume increases even at a faster rate, and the overall blood volume basically tracks with plasma volume. So the mom has a lot more fluid in general. This causes a lot of different things. You have to pee more. You've got more fluid overall. You have more blood, so you have more blood pressure, higher blood pressure overall. Pregnancy glow, not everybody has it, but if you're pale like me, you will appear pinker during pregnancy because you've got more blood volume. And more fluid in your body is more fluid in your body. Of every kind of fluid in your body. So if you have a snotty nose, it's going to be more snotty. If you sweat, you're going to sweat more. You've got more fluid all over your body. So that changes a lot of things, and I'll come back to that in a few minutes. One thing that can happen during pregnancy, and the main reason why you have to go to checkups, is to watch for this condition called preeclampsia. What preeclampsia is it's a dangerous high blood pressure that damages the placenta. So the placenta is feeding the baby, or the placenta is the interface between the mom and the baby. I tried to look into the physiology of it, and it was more complicated than I imagined, so I'm not going to talk about that. But it damages the placenta. when you're starting to get it, you will have protein in your urine because you've got more fluid in your body and you've got high pressure and it's pushing stuff into the urine that shouldn't be there. So protein. So the main part of prenatal care is you go to the doctor, they weigh you, they do your blood pressure, you pee in a cup, they go check the pee, they come out and they measure you, and that's about it. It's kind of a letdown. But two of the things are to check for preeclampsia. So blood pressure will go up more suddenly than it has been. And then you have edema. This was the word of the day in A&P2 today. Swelling. Unusual swelling. Like beyond the normal pregnancy level. I was delivered early myself because my mom was starting to have this. So seeing these three signs together is kind of an emergency. You see the foot, like that level of swelling. I don't know how well you can see that. But monitoring for blood pressure, protein in the urine, and edema is to catch preeclampsia early. The treatment for it, there's not much treatment for it. You just have to deliver the baby. So a lot of preemies are delivered early because the mom is developing this. Here's one. This particularly freaked me out because no one talks about this. You have more blood all over your body. You're getting ready to deliver a baby that through history you would nurse it and it would drink milk from you. So yes, everyone knows your boobs get bigger during pregnancy. That is true. But not just bigger. The nipples and areolas get markedly bigger proportionally than they were before. And also, veininess. No one talks about that, but this is something that happens. It's thought that, the baby is trying to find it, so if it's larger and darker, they can find it easier to nurse. It does go back to where it was before. But that particularly just freaked me out. No one told me about this. It does eventually go back. If you nurse, it won't go back until after you're done. Something I didn't know. The next few things I want to talk about are more related to the baby, where it is, how it's turned, and the birth process. One of the ways that physicians and obstetricians measure pregnancy progression is something called the fundal height. So if you had anatomy and physiology and you had to learn that the top part of the uterus is called the fundus, this is why. It seems like very random, like who cares that the top part of the uterus is called the fundus. But the position of the fundus, I need my pointer here. The position of the fundus is generally supposed to rise up as the baby grows. So this is showing at 12 weeks, it's supposed to be right there. 16 weeks, halfway to the umbilicus of the mom. 22, 28, 32, so on. And the way that they measure this is they literally get a measuring tape and put it on your pubic symphysis. And then they feel, where's your fundus? And they measure it in centimeters. So if you've heard people say, I'm measuring big, that's one of the measurements. So the further through pregnancy, the higher up the fundus is supposed to rise. If it's not rising appropriately, that's a mark that maybe the baby is not growing or the fetus is not growing as it should be. Notice how high it gets. If you're short-waisted, like there is no room. You'll be short of breath. This is where heartburn comes from. Like it's pushing on your stomach and it's pushing the contents up. So at 38 weeks, it can get that high if you're short-waisted. Oh, then it went back down. It went back down. That's what's called the baby has dropped. So if you've seen a massively pregnant person, and 1 week they're walking, like generally kind of like this, and then the next week they're walking like this, baby has dropped to get ready for birth, and the fundal height goes back down. Biology people, what's xiphoid process? The bottom of your sternum, that pointy thing. It's supposed to be touching your, so high. Also notice, it doesn't instantly shrink back down. That's a bummer postpartum. Next thing I'm going to talk about is pelvic floor. So looking down on the pelvis from the top, this is a female pelvis. You can know that from the bones or because there are three exits here. Female pelvis. There aren't many babies whose heads would literally not fit through there. That's not usually the problem. Because one interesting thing that happens during pregnancy is that all of your joints relax. So that these joints can relax. Too bad we can't selectively be like, oh, can my sacroiliac joints loosen up and my pubic symphysis and then everything else stay the same? No. All your joints relax. And they will tighten back up later, but that's to let this pelvic cradle slightly stretch when the baby's head passes through. The other thing, have you ever seen this picture? I don't think we show this in A&P. After birth, the pelvic floor will not be that great, honestly. So if you've heard, you should do Kegels, you should do this and that. Maybe you have never heard that, you're young. These muscles can really get stretched out and messed up and can cause bladder problems are pretty common after pregnancy. Because all of this is stretching. Think on that. Maybe that's enough. Okay, so when and this is something I wanted you to write down actually, and I'll just describe it to you in a minute. When it's close for a full-term birth to happen, the cervix, which is the lower part of the vagina, has to open up and also thin out. So the opening part, I do need to write these things on the board because they relate to progression. Okay, so the opening up of the cervix is called dilation. That's some good dilation right there. So dilation is the widening, and effacement is the thinning process. So if you look up here, this is a normal cervix, not during birth. It has a certain thickness and it has a very small opening between there. So what is this thing right there? What's that round thing? The head. Yeah, the head. It's supposed to be head down. So as the baby's head is pushing on the cervix, and there are also hormonal changes that affect this, the opening will dilate, and also the whole cervix itself will get thinner, and that's called effacement and dilation. This picture says dilatation, and I don't know if that's like a British word or just a typo. Anybody know? I've never seen that before, and I didn't notice it until I already chosen this picture, and it was too late. But it's showing 1 centimeter, 2, 3, 10. That says 8, but 10. It goes 0 to 10, and those numbers I want you to remember. So if you're at 0 centimeters, the baby is not coming out vaginally anytime soon. Also, the baby will not be out vaginally anytime soon until you get to 10 centimeters. So during labor, when people talk about she's 6 centimeters, well, you're really not that close at that point. Have you heard those things? The centimeter girls have? Okay. This is how big I like this picture. This is how big. Maybe I don't like this picture, but I like it now that I'm done. So that's how big. And one of the unpleasant things that I didn't expect about pregnancy is that they check you. They check you how far you're progressing. They check you manually, like with a glove, reaching up and they check you. That was unpleasant. But that's how you know how labor is progressing. One of the ways that you know. During labor, what you hope is that the baby is head down, and you also hope that the baby is facing toward the spine. This is the normal position. I started to say for an easy birth. No birth is easy, but this is the optimal position. So head down, facing toward the spine. If the baby is head down and facing toward the front, it's called posterior presentation, which seems backward to me, but people call it sunny side up, and that's not a beneficial thing. It tends to cause more difficult labor. People call that back labor. Some women are more prone to that. Audrey said her mom had always back labor, so she thought that she might, but she didn't. The baby's head is better to be facing the spine. Sometimes the baby is not even head down. That's called breech. Breech position. And there are different ways you can describe breech compared based on what the legs are doing. So if the legs are folded up, fetuses generally are in the fetal position, and they normally have their legs folded up like that. And if they're equally level, that's called complete breech. If they have one leg coming down out of the birth canal, that's footling. You remember that from Jacob and Esau in the Bible? That was footling breech. Or was it it was their hand? It wasn't their foot, was it? It was their hand.
One of them was grabbing the other's foot with his hand.
Okay. That's even more painful. But footling breech. If they happen to be completely butt first, that's a frank breech, and this one is the easiest to deliver. So last week when Dr. Rudd was saying that what did he say? He turned a baby or he had the expertise to deliver breech babies. Some doctors won't do it. It depends on the town. Some of them say it's too risky, you have to have C-section. You can read online ways to get them to turn. Try all kinds of crazy things, get them to turn. A breech birth is more difficult than a head first birth. The next thing I want to talk about is placenta. I really like this picture. This is what a newborn looks like, truly. If they're a big, fat, healthy one, they've got this coating on them that protects them in the womb. It's waxy. And I just noticed they formed that into a heart. How adorable. Normally, nurses will take the baby once it's born and they go clean it up and they wrap it in that blanket with the pink and blue band and bring it back. They're cleaning off this, it's called the vernix. But that's a really, actually that baby already has been cleaned off. But one thing that was surprising to me is that when the baby is born, the placenta is still in there. They don't come out together. You have to deliver the placenta. Oh, you have to deliver the placenta. You think you're done. Deliver the placenta. That's how big it is. It's a fad now for some people say that, oh, you should save this and you should eat it. I didn't do that, but it's becoming a fad. Some societies, they eat it. Some animals will eat it. And it's thought that, oh, it's more nutrition for the mom. Well, it would be. It would be, but that's kind of a thing in some places in the U.S. Time to eat your placenta. So people dry it and put it in pills and then take it ever so often. I think they get thrown away, but mine got thrown away. One thing that can be dangerous is if the placenta, so the placenta is supposed to be stuck to the uterine wall somewhere up in here. It's between the baby and the uterine wall. The umbilicus comes out of it and connects blood vessels between the mom and the baby. If the placenta is lower down, that can be a problem because the baby is going to have to push past it to be born, and it can rupture. So if the placenta is just kind of low, it's called low implantation. If it's partially blocking the cervix, we say it's placenta previa partial. This is particularly dangerous. If the placenta is completely covering the cervix, how is the baby going to make it out without rupturing its own oxygen supply? So this situation, when you read about before modern medical care, some percent of women would die in childbirth, this is one of those times that would be a particularly dangerous thing to have if you're having a natural birth, and this is the situation, it's going to be very difficult, to say the least. And it's called placenta previa. And then, lastly, I wanted to say some about cesarean sections. In the U.S., at least 1 out of every 3 births is a cesarean section. For mine, it was 3 out of 3. That is too high. That is too high. Sometimes cesarean sections are scheduled because, for example, we know that the woman has placenta previa. We can tell that already. You need to have a cesarean for that reason. There are other reasons to schedule them way in advance. Some places, if you have breech presentation, depending on what town you're in, you'll get a cesarean section. Some places, if you've had one before, you'll get a cesarean section whether you want to or not. But we have too many in the U.S. for sure. A long time ago, cesarean sections were done with vertical incisions. So every layer in your body that you've got, there has to be an incision going through each layer. Skin, fat, muscle, 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 because you've got 3 layers of muscle, different orientations, and then through the uterus. These days, they're done as horizontal incisions. And, this is nice, I guess, you don't do one big horizontal. It's not like, you don't do one big horizontal incision, you do a few, and they don't exactly line up. And that's to prevent future rupture. But they call them bikini line incisions. That's probably all I want to say about it now. I'll talk some about like after effects later, but we do too many in the West. We do too many of these. The last thing that I wanted to write down for you is an acronym called VBAC. VBAC. Whoops, up. Okay, VBAC. Which stands for vaginal birth after cesarean. Vaginal birth after cesarean. Some doctors, if a mom has had one cesarean, they will encourage them to go ahead and try a vaginal birth with the subsequent ones. And we call it VBAC. VBAC. There is some more risk to having a VBAC than just a regular natural birth or maybe with a second cesarean, but the benefit is there are limits to how many cesareans you can actually do on a person responsibly. That's not why I quit having kids. Like 3 is good, but doing 4+ it can cause more problems for the mom. So that's a term I wanted you to have heard of before our birth panel today. What questions do you have at this point? What do you want to know?
Why do you say that, like, it's too many C-sections? Like, is it, for the mother's safety or like cost?
It's for the mom, not the baby. The cost is not. It's to avoid further future problems in the mom's lower abdomen, I would say. And there are doctors that will do more than 3. I meant to look up, like, who's the doctor that would do umpteen of them? I don't know. What were you going to ask?
I was going to ask what are some of the problems involved with C-sections.
Yeah. So I can talk some about that while we're waiting. I actually had relatively few problems. This is a cosmetic problem. When you cut through the abdominal walls, like I'm sure that you totally don't want to look at this, but when you cut through abdominal walls, this would be a good time to turn this off actually. So I'm not going to point it at myself a lot.